morning, everyone, and welcome to In Pursuit of Equity. Thank you for joining us. Wisely and from the start, our Seva founders and the Seva staff really knew to listen. And we do that now. We listen to the local and international scientific, social, technical experts. And probably more importantly, we listen to one another. And we carefully listen to the communities and the individuals that we serve. So from listening, we believe we achieve that pathway to equity. So I'm excited about this morning, very grateful that you've joined us. But before we get started, I'd like to introduce you to Smirti, who's our Director of Marketing and Communications.
Hi, everyone. Based on where you're joining us today from, good morning, good afternoon, and good evening. I'd like to quickly run you through a few house rules so that everyone has a pleasant and smooth experience. We love getting questions from you, so there is a dedicated time for questions and answers towards the end of the session. When Kate opens the floor for questions, please send us your questions using the Q&A box that you see at the bottom of your screen. If you would like to speak, please use the raise hand feature and the host will enable your microphone. When you are not speaking, please keep your microphones on mute. And please note that this session will be recorded. I hope you enjoy the session. Over to you, Kate.
We also have Rolando, who's our Director of Technology, working in the background, making sure things go smoothly, as we do Julie, who's our Senior Director for Development. So without further ado, let's get on with today's program. It's really a pleasure and an honor for me to introduce you to three of Seva's strongest and newest team members who are helping move forward on the agenda of equity. And we're going to get started with Ravendra. Ravendra is a development practitioner who has spent 37 years of his life working in 9 different organizations. He primarily serves in Nepal, but he's also undertook international assignments in Cambodia as well as Zimbabwe. He's served as the international director in Tanzania, Uganda, and South Africa, and he's managed to lead 3 different organizations in the role as country director. He's been voted as the best director and a global values champion. He's passionate about our work, especially around young people. And we're very delighted and really honored to have him here today. But Ravendra, before I let you get going on all the stuff that you put together, we're going to reach out and work with a poll. This is your opportunity to interact with us today. So the first question that we have for you today is this. Vision loss is an issue of inequity. And what % of the population do you think women and girls with vision loss are? We'll give you a few moments to engage and give your answers. Okay, you are awake and an active crowd. This is great. All right, the numbers are coming in. I'll close the poll in about 2 more seconds here. And remember, it's all anonymous. Just answer what you think it might be. All right, I'm going to close the poll now. So here are the results. The answer is actually 55%. So you're all in the right range. And I think without further ado, I think we'll go ahead and we'll move along to you, Ravendra.
Thank you very much, Kate. First of all, warmest welcome to all of you from South Asia. So today I'm going to talk about women and children. And I think these are 2 very important groups that I'm going to talk. And today I'm going to focus the women and children from South and Southeast Asia. So I'll be discussing about the situation of women and children, the challenges that they face, and also the opportunities that Seva have to serve for those people. And when we talk about children, there are about 36% of the population in South Asia are under 18. And about 48% of the population are female. So we are talking about a very big population, and almost the majority of the people we are talking about. So Kate, can you go to the next slide? Yes. Thank you, Kate. Yeah, so first I want to talk about listening. So as Kate mentioned, listening is such an important thing. And as we listen to our supporters, we also listen to our beneficiaries, to the people we serve. And we did a listening exercise just recently in Nepal. And these are the findings that we got. So these are 10 big problems or challenges that our women and children uh, told us. And as you see, the biggest challenge, three challenges, and they said was access to healthcare, gender discrimination, and violence against women and children. So these are very important things for us to learn, because it's a very learning process for us. And in Seva, we always think about learning is a very important thing for us, listening and learning. So we want to become a learning institute as well. So this is something that we learned from our stakeholders. So in the next slide, I'll be talking about next slide, Kate, please. Yes. So there was a big survey done by our partner in Nepal, and in this survey, we were talking about and the barriers of cataract surgery, and as you see, there are many barriers, there are many problems in cataract surgery, but in all of these barriers, the the barriers are same, but women experience more barriers than men. So that is also very interesting finding that we got. So there are lots of problems. There are lots of challenges, and 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 that's where we come actually. And as a Seva, we think that those challenges are our opportunities. So I'm going to spend some time in this slide to talk about how we work with the women. So if you see in this picture, the women in a white sari, she is called community health worker. In Nepal, we call female community health volunteer. And this is very interesting, very important thing that I want to share, because female health workers are the part of our government structure, and this is probably one of the best practices from Nepal, because these female volunteers come from the local community. They are based in the village. They are trained. They are self-motivated people, and they know the local culture. They know the local language, and they have very good network. And they are available 24/7, and they are also the member of the mothers group. So it's very easy for us to link with the women, with the mothers group, and with the users group. And they might be the most trusted people in the community, because they have been serving to the people. So that's how we link our program with the mothers and with the users group. So in the next slide, I'll be talking about how our Seva team connect with the mothers group. So in Seva, we have got youth coordinators. So these are basically the change makers. So these are young people who are highly motivated. They are trained by our Seva staff and by our partners. And they are equipped with basic eye care services, skills, and they are based in field. So what we did is, we partnered together with those female health volunteers and the youth coordinators. And in the next slide, I'll be talking about what we do together with female health workers and these youth leaders. So they together we go to the villages and we do the counseling sessions, we do awareness camps, and we do lots of other activities like door-to-door visit, and also we link them to the hospitals. So that's the way we are able to connect our programs, our services to the people, especially for the women. So this is something that we have been doing, and it has been so successfully done actually. So in the next slide, I'm going to change my subject here, and I'm going to talk about children. So children, during this pandemic time, they have faced many problems, and the problem they faced, during this lockdown time was that, the schools were not open, they don't have much things to do, and they again had the problems with the classes. So it was very difficult for us to reach the children. And one of the things that we need to remember is that we have only 12, pediatric ophthalmologists for 30 million people. So it's a big challenge that we are facing to reach out these young people. And there are other reasons like the economic condition is very poor in this region, and geographical challenges are also there. So there are many problems like that, and we needed to come with some innovative solution. So in the next slide, I'm going to talk about how we came up. Our young people and the female health workers came up with some innovative ideas. So although we are working in the developing country, one of the things many people might not remember is that even in developing countries now, social media is taking over. So there are lots of Facebook users even in Nepal. About 30% of the total population use Facebook, and about 60% of the people are young people, especially children. They also use Facebook. So we thought that going beyond the conventional way, we did some innovative ways to reach out the children through the social media, through the Facebook campaigns, through videos in the YouTube. This is one of the picture I'm showing. This is being created by our youth team, and this is the children's book, and the illustrator was a very young person, who became Seva's supporter, and he did pro bono. He did all these things for free for us, and this book has been so popular among the children. So we have tried different other ways, like we did FM radio, dramas, webinars, and even the rap song. Young people love to be cool and they want to enjoy. So we did rap song, but the message was on eye care, how we should take care of our eyes, why we need to go to visit the doctors when there are problems. So those are the things that we did with this. And then this is one of the model that we used. So we basically create awareness. So we create awareness, we create a kind of demand. Then we provision to the services and link to the services. We also make sure that they get a good follow-up care. Then also, very importantly, we also ensure that there will be a quality service. Standard operating procedure should be there. So we go with this cycle, and at the time when we come back to create awareness, we always improve. So this is a kind of cycle that we are going through. So this has been a very useful model for us to reach out to kids. So finally, I have just a last slide now, and I'm going to tell us a small story. And this is, this is a very inspiring story for me, and I hope that you will also like it. So, so if you see this woman, this is again the female health volunteer. In the background of this picture, there is an island, I mean, many people might not know that there is Nepal has got lots of big rivers, and within this river there is a place called Sri Lanka. So there is a Sri Lanka within Nepal, and this Sri Lanka, island in this river is inhabited by internally displaced people, very poor people, and and they're very ignored. And this female health volunteer, she told us that no one has been to this place before. I mean the health workers, so they are mostly ignored. So our young people decided to go with this female health volunteer to look at the situation. And when we reached there, the people there, they told us that no one cares. We can't see, that means we can't hear. People think like that, and they have got so many challenges. They wanted to go to the hospital, but no one has taken to the hospital. So our young people and this mother, her nickname is Sevika Ama. So Sevika Ama actually means, the volunteer mother. So she's very popular in that area. So she was, when she told, and when our young people also convinced these, patients, there were about 40 patients. And out of these 40 patients, 25 patients decided to, get treated. So we brought them to our hospital in one lot, and all of them got the surgeries. Most of them got cataract surgery, and all the surgeries were so successful. So we took back to them in the island, and now these patients has become the ambassadors. So they are convincing other patients to go to the hospital, and also talking about how they should do in the hospital, and how happy they are, because some of the patients, they never saw their grandchildren after they had a cataract, and they saw their grandchildren for the first time. So they were super happy with that. So these are really inspiring stories. So I myself get inspired by those sort of stories, and that's why I love working with Seva, and I always get excited working with those people. If you see here, this female health worker, one thing she told us was, you see more clearly when you listen to the community. So that's what she told us before she took us to the village. And that is so true. Although we are development workers, although we work in eye health, in eye sector, we need to see clearly, and we need to listen to the communities. So this is my story, and I hope that you are inspired by this story, and and again, thank you very much for listening. So I'm very happy that if you have any questions later on, I'm happy to answer those questions. Thank you very much.
Well, don't go anywhere, Ravendra, because I think, first of all, thank you so much. Who knew there was who knew that there was a rap song out there and a volunteer mother? I love the passion and the thoughtfulness by which you care about this work and we're engaged with our communities. So keep that thought. Folks that might have questions, feel free to write them down on paper, or feel free to go into the chat room. Julie and Smirti are going to be looking at your questions, but there'll also be an opportunity to raise your hands, and we'll be calling on folks in just a few minutes. We've got two more brief overviews that sort of, these are like our building blocks. Women and children is a very, as you can imagine, a fundamental and essential part to equity as we look at the world and we try and bring and try and end avoidable blindness in our lifetime. But another aspect of it is technology. And Kuldeep is going to talk a little bit about how we work with local partners to co-create solutions and give you an insight into some of the call for ideas that the Seva Foundation sponsored over this last year during the pandemic. So before I get into, I have a poll question again at the top, but let me briefly introduce Kuldeep. He's worked with the Indian government for almost 10 years before venturing out to work as a consultant and work with not-for-profits. And his areas of expertise include project management, program implementation, and evidence-based research. He has a wonderful and long career. He's a management graduate and he's studied sustainable development. He's a strong believer in the compassion in action and selfless service. And in his free times, he loves being in nature and exploring the realm of meditation and ancient wisdom. And it really comes across in how he reflects and thinks about the work. So let's go without further ado. You have another opportunity to interact with us today. And I'm going to go ahead and launch the second poll question. And the second poll question asks, is the world free of avoidable blindness? So fill in the blank. At least what % of vision loss is completely preventable or treatable? I can tell you our supporters of Seva being rapidly engaged. Thank you so much. Terrific. We're going to go ahead and I'll go ahead and end the poll for now in 2, 3, 1. Here we go. So it's actually 90%. You're right. You might remember back in the day, even as little as maybe 2 years ago, we were reporting that 80% of blindness is preventable. But the new report coming from the Lancet report and IAPB indicates that 90% of the world has preventable or avoidable or treatable blindness. That's a remarkable number. And that's one of the many reasons why the staff here feels a sense of urgency to close that equity gap. So helping to close that gap was really great pleasure. Kuldeep, the floor is yours.
Thank you so much, Kate and Ravendra, for sharing your story and your inspiration. Namaste, everyone. I'm Kuldeep from India, and I'm very excited to share a glimpse of Seva's work around providing equitable technological solutions for improving eye care. So the first slide that I have prepared is around talking about the barriers. So generally we talk about technology, we talk about there are many advanced things, but when it comes to delivering eye care, each of the Seva partner is at a different stage of working with a unique geography and audience. And that is why the need of technology with the partners is also very different. So we have been working closely with them on the multiple aspects. For example, a remote hospital in the rural area, for them, technology is also very closely to be able to connect with the teleophthalmology or the doctors sitting in the base hospital, or if there is an advanced hospital in the urban cities, they would like to look for a device, advanced screening device, where they can screen a lot of people with the high quality and being able to save their time and the time of their clinician. So that with that aspect of the technology, considering there is a huge disparities, and then when pandemic comes, this was even exposed further. So these are some of the challenges that we have been working on, and Seva has been working on so many different solutions. Some of them I'm going to share with you in the following slide. But before going further, in the next slide, I would like to introduce one of the Seva patients, Ankush, who comes to the partner hospitals in West Bengal at the age of 4, as you see in the very first slide. And as Ravendra was talking, how scared, I mean, the ophthalmologists who actually are able to do the cataract surgery or provide the treatment to the children, how they, I mean, their number are very less. And this is a remote rural area, not very much connected to the big cities. So when he came in the age of 4, he was having cataract in his both eyes, not able to see. The operating ophthalmologist, Dr. Asim Sel, Sevas Partner Hospital, from Sevas Partner Hospital shared he was only able to see the perception of the light. Luckily, with the supports, with the facilities available at the hospital and the ophthalmologist and everything around, he was able to walk by himself in the next 15 days. And as you see in the second picture, now he's able to see, study, play with his computer, and also do everything that he wants. So this is one example of how technology and facilities developed by Seva and its supporter are helping many patients, which is otherwise very difficult. So in order to do these simple surgeries for children, there is a need of specialized support system, advanced referral system where the patient can be referred from rural area to the base hospital, and also a lot of infrastructure that are needed to be able to provide these eye care to the children. So with that background, I'm going to introduce in the next slide is about the Global Site Initiative network of Seva Foundation. Here we work with a group of mentor and mentee hospital to co-create and develop the technological solutions. With the help of the Seva partners, we are able to not only the leverage the technology which are available, but also explore the new technologies, develop them, co-create them, and being able to work with them all together to provide the solutions related to eye care, especially when we still have 90% of the eye care that can be treated, as you see in the previous poll. So Global Site Initiative work in almost 20 countries, and we are working very closely with the partners to tap into their talents and being able to provide technological solution in a culturally appropriate way while keeping the affordability and high quality of the care in the mind. So in the following slide, I'm going to share some of the initiative that we have worked with the Global Site Initiative Network through the Seva's Call for Technology idea. It was one of the important initiatives sponsored by Seva, and this is something very close to my heart. And I really feel very happy and to see what it is delivering on the ground. So the call for ideas was actually the design to source local technological solution in a very competitive process while working with the partners on the ground level situations. And we were able to develop, design, and manage and adopt some of the new technology while working on the earlier technologies as well. Most importantly, these solutions are developed by the partner hospitals, and also they are ready to be deployed immediately as soon as they are there to do their magic. So last year there were many entries we received, and some of them, actually very few of them, were able to go into the final list, where Seva supported some of them. And here I have brought a few examples for you to just to share what are the different work and technological interventions we have developed and supported in the last year. The first one is actually around enabling the access, especially in the primary eye care settings in the rural area, where Seva partner hospitals, the previous slide, talk about the cloud-based software in the remote area, and that enables eye screening at the doorstep in the village. This slide, which is mostly around the corneal blindness, as we see, the corneal blindness is one of the leading cause of blindness in the low and middle income countries. Here, one of the Seva partner hospital is developing a smartphone-based low-cost handheld device, which allow the technicians in the remote area and the low resource setting to be able to screen the cornea and being able to refer it to the ophthalmologist in the cities or wherever they are available, which actually help them to be more efficient and also kind of being able to reach to the people who may not have the eye care in their vicinity. Going further, another exciting example of the call for ideas in the next slide is around the work around that we have done for the retinopathy of the prematurity. As many of you know, ROP, the retinopathy of prematurity, is an eye condition affecting prematurely born babies, generally having received the neonatal intensive care, in which oxygen therapy is used and due to premature development of their lungs. So basically, ROP is an area where intervention is needed in the very early stage in order to be able to help children. And this particular work on in this particular intervention, we are working with we are trying to develop a ROP screening and exploring the low-cost camera systems for their efficiency, which is validated by AI and that can assist in the ROP screening platform by one of the Seva partners. This will allow not only to implement the AI-assisted telemedicine with the minimal capital investment, but also effectively targeting the early detection and treatment of the ROP in the children. So these are some of the examples that we have, but there are a few more which we supported last year. I am not going to talk about all of them, but going further to the next slide, I also want to share Seva is not only working with these technologies, but many other ongoing processes where we are supporting the electronic medical records in the hospitals in order to help them being more efficient, also contactless in terms of the what we have around the pandemic, and also being able to help them in developing their monitoring system, helping their primary eye care centers to be more efficiently managed, and so on. So at the last, I want to say, despite of our best effort by Seva and its partner, for which we are very proud of, but still there is a lot to be done. We'll continue working with the partners to do better every day and working toward our goal of ending avoidable blindness. Thank you so much for listening.
Oh, Colby, thank you so much for being part of this team and for everything you've brought to the work that we're doing. I do want to encourage folks to, Kuldeep is going to stay put. We're going to have an opportunity to talk more with you in just a few minutes. But just to recap, that's a beautiful overview of the Global Site Network. It was started as an initiative for Seva when we were trying to make sure we could address more cataracts. And the staff and the partners and the communities are beginning to realize that it's really more of a methodology. This is how the Seva Foundation sees the world and engages in the world. And it's a level of dignity, reciprocity, listening, good data, and lots of compassion. And I think you could see a lot of the results of that in some of the call for ideas. And the call for ideas is something that bridges not only technology, but our emerging and our ongoing work with Native nations. It's the belief that the communities that we work with really do have wonderful and scientifically based solutions to their own problems. But there's a commitment that if we work with communities, that there's a commitment to sharing that learning. That's a fundamental aspect of the methodology, that we get out there and it's not just for me or for you. It's actually something that if we have a great idea and a great solution, we're willing to share it. So without further ado, I'm going to introduce you to our newest team member, Jennifer. She's the program officer for the American Sight Initiative, and she is a member of the San Carlos Apache tribe. She has a deep commitment to creating opportunities for success in Native communities. And in the past positions as an Indian Education Program Coordinator, a board member for the Southern California Indian Center, and program officer at the U.S. Department of Education, Office of Indian Education, as well as other community and tribal organizations. Jennifer has helped a wide range of programs build success in education, language, and culture preservation. She with her extensive background in program development and program evaluation, I believe she's very excited to be joining the Seva team as a program officer, and she's responsible for the American Sight Initiative that spans, at this point, 6 different states. She's a recent transplant to California and loves the desert and hiking. So we're very honored and delighted to have her here today. And we're really throwing Jennifer into the deep end of the pool. I think it's about her 2-month anniversary. So as we have in the past, we're going to give all of you an opportunity to participate in a poll. So our new poll, and our last poll for the session, is about causes of blindness. Blank is the leading cause of blindness in adults in the United States. All right, you're doing a great job, very engaged. I'm going to go ahead and end the poll, and I'm going to share the results. So the answer for this one is diabetic retinopathy. It's the #1 cause of blindness in adults in the United States. Let's go ahead and turn the floor over to you. Jennifer, good morning to you and welcome.
Agwyd Ustro, Jennifer Leo Gonse, Childit Adn Bashis Tino Narnishli, Ahia Hello, everyone. I am Jennifer Leo, and I come to you from the San Carlos Apache Nation. And I'm very excited to be speaking with you today about eye health in Indian communities. To start, I think we're going to talk a little bit about the US. So we have some statistics here about eye health and eye issues in the United States. And it sounds like you already had an idea that diabetic retinopathy was a leading cause of blindness in adults in the United States. This is a big issue when it comes to Native communities because the incidence of diabetes is actually incredibly increased within Native communities. So I think we have a statistic there that says that we're at 14.6% in Native communities as compared to the general population of 10.5%. However, when you break that down a little further, there's actually a significant difference of about twice the instance within Native communities of other communities. So it's a huge issue, and not just one that I speak about. It actually hits very close to home. My twin sister and my father are diabetic, and my father in the past 2 years has been experiencing complications of diabetic retinopathy. So it's something that is definitely very close to home for me. Next slide. So a lot of the issues that Native communities face are some that may be familiar to some and may surprise you a little bit. So of course, poverty, that's an issue. Also geographic isolation for many people who are living on reservations. It's just really too far to get to an eye clinic to be able to get treatment. But a big issue that people may not realize is the lack of linguistically and culturally appropriate care. I was speaking to one of my friends the other day who comes from the Ute Nation, and they told me that the eye clinic there, which unfortunately has been closed down now, has been run by the military. And there just is not a lot of warm, fuzzy things going on with military eye care clinics, but it's also just a huge cultural difference when you're talking about providing eye care for a Native community. So it was a challenge getting that care to the community via that clinic, and this is a common kind of issue with Native communities. Another huge issue that has been affecting many people, of course, is COVID-related barriers. So you may have heard that Native communities have been incredibly impacted by COVID-19 with increased infection rates and mortality rates in Native communities. So again, this is an issue that has hit very close to home for me. There was a 2-month span in the summer of 2020 where just about every week I was losing a family member. And that has created a situation where many people have been incredibly hesitant to do things like receive treatment for eye care or anything else. In fact, my own dad, who I mentioned has diabetes, he also is on dialysis, and he began skipping dialysis appointments just because of his concern about the health and safety that he would have if he were to go out to a new place. So it's been a huge issue in Native communities just trying to deal with the impact of COVID-19. Next slide. So at Seva, it's been so great to learn what kind of opportunities are being created through these great programs. And one of the big focuses of Seva's approach is to really look at what communities need and what they're doing and create partnerships within those communities rather than try to impose something that may or may not work. A lot of the focus in these efforts is on looking at eye care screening, so different ways to do that, going into the communities, creating opportunities, whether it be, bringing the eye care screening to where the community is, going into schools, creating awareness, also providing medical treatments, and then also providing eyeglasses for community members. And then another big focus is investing in telehealth innovations. This is huge for Native communities, for so many people who are isolated in remote areas, but also for people in Southern California or someplace urban that maybe just don't have the opportunity to be able to go into a clinic, whether it be because of COVID concerns or because of family obligations. It's a huge benefit to Native communities to be able to have the prospect of telehealth. Next slide. So I want to talk to you a little bit about a clinic in Oklahoma that I've had the opportunity to do a little bit of work with since I came on board with Seva. And they were experiencing some of the challenges that are really common among many Native nations. So at the clinic, a limited capacity had forced them to create restrictions that didn't allow for as many patients as they would like to see coming into the facility. And these actually kind of eliminated anyone who was above the age of 18 or not a senior citizen. So a huge range of individuals that were not able to go to the clinic. Additionally, because of the limited capacity, they weren't able to offer many services. And they started seeing a high instance of no-shows at the start of the pandemic, which continued forward, that patients were having huge concerns, similarly to the way my family members were about their health and safety within the community. But with the Seva partnership, so many wonderful things have been able to happen at that institution. So first of all, they were able to create increased capacity, which allowed them to be able to eliminate some of those restrictions. And if you see here this image, this is a young woman named Skylar who had been previously excluded by those restrictions. So she wasn't able to get any eye treatment, but once the restrictions were lifted, she was able to go in. So she actually spent 5 years struggling with vision issues, which caused her to have all kinds of personal problems in her life. She was having headaches. She was not feeling well. She would call into work sick because she had such terrible headaches, and it was really impacting her life and her family's life. So once they were able to increase their capacity, it helped a great deal. And in addition to that, at this same clinic, Seva was incredibly responsive and able to provide PPE to the clinic so that they could, as you can see here, she has her mask on, that they were able to provide equipment that would ensure for the health and safety of the community, so that they were able to feel less concerned as they were trying to come in for their eye treatments. So if we go to the next slide. Oh, we missed a picture. Oh, she's over there. Okay, sorry, I wasn't able to see it. Anyway, it's an incredible story, and one that in so many Native communities, people are so in need of just these basic things: being able to go to work, being able to get an eye screening, being able to get glasses so that they can do their jobs, so that they can support their families, so that they can have assurance of health and safety in their lives. And it's very exciting for me to be, it's only been a few months, but to be able to see that Seva has been so sensitive to the needs of the community, so collaborative, and then so responsive with issues like with the pandemic, to be able to support Native communities. And it's a great start for me in my journey with Seva, and I'm looking forward to the road ahead.
We are too. And we're just in such terrific company, as you can tell. I mean, Jennifer, I can't tell you how happy we are that you chose to say yes to the assignment. I almost said yes to the dress, like that reality television program, but you said yes to Seva, and we're very delighted that you did. I think at this point, what we're going to do is we're going to take it off question, and we're going to go ahead, take it off the slide so that you can see your speakers nice and clear. So just as a reminder, you have a bar at the bottom of your Zoom. Feel free to go into either the chat or the Q&A and ask questions. We're monitoring both. And of course, as any good facilitator would be, I have a couple of starter questions to get us going. So Jennifer, we talked a lot about you. First of all, I want to thank you. You were generous this morning because you shared personal experiences from your own family. And that's exactly the kinds of stories that really keep so many of us, including myself, up at night, is like, how do we do better? How do we reach people in a way that's more efficient and also more effective? Why don't we take a few steps back and go back and maybe look a little bit closer at diabetic retinopathy? And from your perspective, it's a major cause of concern within Native communities. What would you like to, what comes to mind for you that you think is really important that people, understand at this point in time, and why that's a focus and why that's going to be something that we'll be attending to over the next couple of years?
It's such a interesting issue because I think that a lot of times people look at diabetes and they think about weight, or they think about just kind of general sort of blood sugar or other things, and a lot of times the eyes are left out of that conversation. And so I think for me, something that I would like other people to think about in thinking about the issue within Native nations is that that vision is such a critical component of that conversation. And, having seen the trials that my family members have faced, my dad actually was at work one day and completely lost the vision in one of his eyes, and, was trying to finish out his day of work and ended up, having to try to drive home, which it's, 30 miles back to his house. So it was, quite a challenging day for him. And then in being able to get treatment, he had to, travel another large distance. So these kind of things are really critical components of the conversation when talking about diabetes within Native communities. And so I would like to see, more light shed on that, more research done, more opportunities for treatment. Currently, the treatment within Native communities a lot of times is sort of the late stage rather than the kind of preventative early stage. And I think that if people kind of understood better what the opportunity was to work on prevention in the beginning, it would definitely impact the results at the end.
Right. And then just a quick follow-on question, are there many ophthalmologists or optometrists that are themselves Native serving in our Native communities?
So it's an incredibly low instance of that. Even any kind of health providers at all in Native communities are incredibly rare. And as I mentioned, I was speaking with some of my friends from Ute Nation where they did previously have an eye clinic that was run by the military there, but it's been closed down. So they have no access to eye care on the reservation. And this is a very common situation, all over the country, that there are many Native communities that have no access to eye care at all. You would have to drive probably 300, 400 miles to get to a place where there was actual access. And so, not even just that there aren't Native providers, but there's no providers at all. And so that's a very common instance.
We have a question that just came in from Christy Coffin. She's a volunteer with Seva. She wants to know if the community health worker approach is used in Native communities.
So that is definitely something that happens commonly. And Native communities span kind of a broad range of places because a lot of times you have some of your largest Native communities actually in urban settings. So in places like Southern California, where I am, or where I came from in Utah, a lot of times community health workers are very important coming out of urban Indian centers. And that approach is very common coming out of urban Indian centers.
Ravendra, we haven't forgotten about you. Let's go back to the beginning. Let's go take ourselves a moment and think a little bit about women. So I've heard that in a hospital in Nepal that 2/3 women are doctors. And if that's the case, does it make any difference in women seeking out eye care? Does that representation factor matter?
Yeah, definitely, Kate. I mean, one of the good thing about having a female doctors in our hospitals is that it is, I mean, easy to communicate and approachable for the population, and also, I mean, this. I mean, the experience has been that they are more compassionate and more cool, you know. And that is one of the reasons why we are able to serve more female patients, and with Seva, I mean, we also promote more training and more capacity building for the ophthalmic assistants and the doctors, and also promote the female health workers in that sense. Yeah, thank you.
A brief follow-on question about I've gotten two questions now. How can people get access to that children's book? So people are writing in and wondering about that.
Yeah, actually, I mean, this book has been so popular. I mean, we have an e-copy of that book, so we can share that. I mean, e-copy very easily. We don't keep copyrights, so I mean, it can be reproduced. So that's a good thing. And we are coming up with another series of this book. So the same, I mean, a volunteer who did pro bono, I mean, a contribution for us. He's going to, and he and her, his, I mean, companion is going to make one more book very soon. So it is very available, I mean, easily available. And if you can give us your, email addresses, I mean, I can send that links very easily. Yeah, thank you.
Oh, great. But before we move on, because there's some questions rolling in for you too, Kuldeep, so get your thinking cap on, they're coming at you. Ravendra, can you talk a little bit more about softer interventions for women? And maybe what would be really fascinating for the folks on the line today to hear is, tell me where our partners start in a line and why.
One of the things we experience is that, when I mean, we try to serve the communities, and usually the women are in the back of the line. I mean, they are usually, I mean, come, in the back, and our young people, I mean, they broke the rules, and they actually started serving from the back of the line. So from the last of the line, they started, I mean, serving the people. When we did, community engagement meetings, usually, I mean, the community leaders, the male, I mean, they usually come in the front. So we make sure that our youth volunteers, I mean, they make sure that, I mean, the women, I mean, comes in the front and they speak their problems. So that's how we encouraged women and also the children, that I mean, we when we do community meetings, I mean, we interact with them and we bring them in the front. Yes.
This one might be for both Kuldeep and Ravendra. We'll start with you, Ravendra, and we can end with you, Kuldeep. So are there efforts to recruit more women as AOPs or doctors in Nepal and India, or is this do you just do we leave this sort of up to chance and serendipity?
I mean, we definitely promote more AOPs and female AOPs, and we have a training, we have scholarships, and also, I mean, we promote our partner hospitals to recruit more AOPs, female AOPs, because I mean they are the ones, I mean, who I mean come in the front line, and I mean easy to access for the female patients. So we have, I mean, lots of capacity building, programs, and also training for those AOPs. Yes.
Thank you. Kuldeep, what about India? I'm hoping you haven't.
Yeah. Thank you. So building upon the Ravendra's answer, actually some of the Seva partners prefer to have female AOPs. So one of the criteria they initially started to have the AOPs who are female, and there are different benefits to them for having female AOPs. Some of them Ravendra indicated. So there is a preferential culture, I would say, for especially for AOPs, while the doctors are something that is the demand is much higher than they are available. So I guess the preference may not work in the same way as there, but yes, many partners are working actively to have female AOPs and also helping them to get the training, recruit them from the remote rural areas. So we are able to reach out to them instead of they reaching to us.
And sorry, I should have done this at the top. AOP, for those that are maybe tuning in for the first time, what does that mean for us?
So they are the allied ophthalmologic person who actually help us. I mean, just to put in a simple ways, they are the workforce who actually help our partners to do everything they are doing in more efficient way, in more better way, and while taking care of the patient need in more compassionate way. So all the support staff who help ophthalmologists to do the things in the operation theater and outside. So they are the backbone of the any partner hospitals.
Yeah, in one
That's
of
exactly right.
Yeah. Kate, in one of our research, I mean, we found that 80% of the eye problems are actually dealt by AOPs. So I mean, so that makes our doctors more specialized in other serious works. So AOPs are very important. I mean, and again, I mean, they serve so many people. So that's something that we need to remember as well. Yeah.
I remember my first time several years ago traveling to the field and seeing thousands and thousands of young people coming out of their training. And they sometimes in literature, our supporters might hear it as mid-level or allied personnel. And I think this idea that they help amplify the efficiency of an ophthalmologist. So the ophthalmologist can stay very focused on the surgery itself and can pivot and help more than one patient. And these teams of allied professionals basically incubate or cocoon the patient and make sure that you get the eye drops you need, you get the service that you need, the care, you're attended to, you're helped off of the table, you're brought back to the waiting area. It's a remarkable group of men and women, and the majority of our AOPs are women worldwide, but it's a pretty remarkable career path for so many. And something I think that Seva Foundation was certainly one of the early adapters, if not originators of. Let's take a look of other questions here. Kuldeep, one question that's just come in India, why is diagnosing ROP a problem in India?
Yeah, thank you for
and start with explaining what you said it in your presentation, but just a quick reminder, ROP is, explain a little bit about what that is first.
Thank you for this question. So putting out there, I am not the expert or the specialist who can actually talk about the technical detail, but in the simple language, as I learned from the partners and the ophthalmologists we work with, is an eye condition that affects the premature born babies who have received the neonatal intensive care, in which the oxygen therapy is used for development of their lungs. So basically, there are some eye conditions This is an eye condition which is primarily into the prematurely born babies. And that is also a part of the challenge in a way, because most of these babies would be born in the uh, specialized care unit, which is not the partner eye hospitals. They could be a government hospital very far from the specialized eye hospitals. And that is why being able to reach there, being able to screen for the particular eye condition, and then bring them back to the eye hospital for getting this treatment, or alerting to the ophthalmologist to make sure they get the treatment, is a very difficult process. Also because you need to have all screening devices and expertise to be available in the general hospital where the neonatal intensive care unit is there. So our efforts, as one of the technology we mentioned, is around helping this screening done at the place where the babies are born.
Yeah.
Yes, and also the numbers in India make it a much larger problem than the other.
Right. And that's a big reason why one of the tech ideas that was advanced came from one of our lead partners there. And it was a way that practitioners could rapidly assess whether or not an infant in that ICU what did have ROP, because the quicker they know about it, the quicker they can start the interventions. And so I think that's a reason why our partner wanted to try and see if they couldn't have a technology approach to further diagnosing children and infants rather. We only have about 15 minutes left. So what I want to do is give each of you an opportunity to take a moment, because we have a special video for the guests that have joined us today. So what I want to do is give each of you a minute to gather your thoughts and think about what's your parting message. A lot of the people on the line today have been at Seva's side for a very long time. And we certainly don't do this work without this kind of support. And you hear it a lot from different organizations. It's really not hyperbole. It is very real. We are not able to go out there and change the world and do what we're trying to do without the generosity and support of our supporters. And so give some thinking to what your parting word might be in terms of what are you most hopeful for in the year ahead. I know you have a lot of, I've seen your work plans. You guys are going to be very busy. So try and choose one thing that really gets you up in the morning, that you're the most excited about. And as you're thinking through that, I wanted to attend to one question that just came in from Joan. She wanted to know how we distribute our funds as an organization. And I can say that we have something called a participatory budget methodology. We start with the conversations with our partners and in the field, trying to evaluate first we take a lot of data. So we try and evaluate how well we've done in the past year. We ask ourselves the tough questions about what didn't work or what worked really well. And then we listen to, well, what are the plans for the future? What do our partners and our experts on the ground think is needed? Then we come together as a team and we talk about it on a global scale. We have a strategy that has 5 elements. It spells out the word FACES. It was not intentional, but there's fundraising, of course, because we need to be able to have the funds in which to change the world. And then we have 3 core elements of our programming, which are access, capacity, and evidence. And that's basically a tight commingled unit of activity. And we make sure that there's not only access and capacity building, but then we make sure that the efficacy of our work is what we believe it to be. And we collect data around all of this. And then the last portion of it is the storytelling. And that's an industry word. You could call it marketing and communication, but it really is in an effort to be transparent and very human about the impact that this work is having. And so we have a strategy, we have the conversations with our partners, and then we sit down and we take a look at what the needs and the appetite is for change and for programming. And we go about doing that. And then we start to have a dialogue with our board. And so overall, the way it's done is as equitable and transparent as possible, highly inclusive, and it's long. It starts in February, and we don't really approve the budget until June. So it's a very lengthy, interactive process. And about 80% of our funds go towards what we know scales and can serve more people. But we keep 20% of our funds for where we believe the need is the most, so that we always want to be able to be there and not have a return on investment, but necessarily have a return on the mission. So Joan, you know my email. So if that didn't quite answer your question, let's hook up offline and we can talk a little bit more because you're very important to me, and it's nice to see you this morning. Thanks for joining. So without further ado, let me turn this over. I'll go in reverse order. Jennifer, would you like to kick us off with what's your big wish? What's the thing that's going to get you the most excited for the year ahead?
I'm very excited to see what's going to be happening kind of post-COVID, because so many things have been stalled out in the Native community in general. And so I'm excited to see people getting back out there. And what I'm very hopeful for is that with our Seva partners, we are going to see people really embracing the opportunities that have been created for eye care and for treatments, so that in Native world, we often look at life as following a road, and I want to see as many people as possible following the road with great sight. So that's what I'm hoping for.
All right. We're lucky to be traveling that road with you. Kuldeep.
Thank you. And it's a very interesting question. It reminded me when I joined Seva, I visited one of the partner hospitals where they were organizing the eye camp. And in midst of all the people who were there, one old lady came. In India, we call old lady like a mother, like Amma. She came and she had a paper, don't know how to read. And she was also having cataract because it was very much visible, very mature one. So one of the volunteer helped her to reach to the doctor and being able to diagnose for it. I get a chance to meet her after a few days when she was operated, and she was super happy. So one of the things I look forward to see is that smile. So whenever we do something and all the Seva team together, I mean, this is something inspire you every day. I mean, all those smiles or many more smiles. This is something I am very looking forward to see going ahead.
That's beautiful. Thank you, Kuldeep. And Ravendra, what's your parting thought for us today?
Yeah, the most important thing which makes me excited is the innovation part. I mean, because we are looking at the innovative ways of serving our people, and one of the innovative the approach that we are taking is the tele-ophthalmology, the telemedicine part, and we are in the early stage. I mean, we are doing a lot of research. We are trying to learn from others, but this has got a big opportunity for the places like Cambodia, Nepal, and even in Pakistan. I mean, we have got such a big opportunity for us to work through tele-ophthalmology, telemedicine, and this is something that which makes me excited. I mean, it needs investment. It needs more kind of budget or more funds. But we are committed to look at all those possibilities and to make sure that those sort of innovative approach to serve our people can be done in a more effective way. Another exciting thing I would like to add is to reaching out the kids, reaching out the children. As I explained to you earlier, we have tried different other approaches than the conventional approach of going to the school and doing school screening. But there are many other ways to reach out the children, and there are children who never go to school. Actually, they are children who are out of school. So we need to also think about those people as well, and the innovative approaches helps us to reach out those people. So innovation will be a big focus for our programs in the coming days, and I'm really excited with all those possibilities. Yeah, thank you.
Thank you so much. Well, I think if the antidote to injustice is equity, then the mechanism for change is probably listening. So I want to thank everybody who joined us today for listening, not only today, but throughout the years, and for supporting Seva. Many of you know that we stand on magnificent shoulders. We have founders and originals who have been committed to this idea and this mission for decades. So on behalf of the Board of Trustees and the entire worldwide staff of the Seva Foundation, I'd like to give you a bit of a musical gift as you go off to either enjoy the rest of your Thursday evening or begin the beginning of your day. And so without further ado, I think, Rolando, why don't we go ahead and share our message of love and humanity from no other than Wavy Gravy.
Clown to tower, I went into space. 1, 2, 1, 2, 3, 4. And wouldn't it be neat if the people that you meet had shoes upon their feet and something to eat? And wouldn't it be fine now if all humankind had shelter? Deep down. And wouldn't it be grand if we all lent a hand so each one could stand on a free piece of land? And wouldn't it be thrilling if folks stopped their killing and started tilling the land? Basic human needs, basic human deeds, when what comes naturally. Down in the garden where no one is apart. Deep down in the garden of your heart. Deep down. And wouldn't it be daring if folks started sharing instead of comparing what each other was wearing? And wouldn't it be swell if people didn't sell their Mother Earth? Basic human needs, basic human deeds, when what comes naturally. Down in the garden where no one is apart. Deep down in the garden of your heart. Deep down. Not just churches, not just steeples. Give me peoples, helping people. Not just churches, not just steeples. Give me people, helping people. Give me peoples, helping people. Deep down, will you come away down? Deep down, come away, way down. Basic human needs, basic human deeds, when what comes naturally. Come away, way down. Down in the garden where no one is apart. Deep down in the garden of your heart. Human needs, basic human deeds. Down, down, will you come away down? Deep down, come away, way down. Not just churches, not just steeples. Give me people, helping people.
Thank you again, everybody. Join us. We'll have more conversations with Kate. Let us know what you're interested in hearing more about. We'll make sure that we bring in the team and our partners to answer those questions. Have a wonderful rest of your day and stay safe.